we will be detailing data about VDPHL01, the first minoxidil extended release tablet. The idea being that minoxidil is a proven agent, for hair growth, and that it's approved as a topical. And we're trying to optimize it to maximize hair growth, minimize cardiac risk through an extended release tablet that provides consistent and durable exposures of minoxidil throughout the day. Specifically at the AAD, we are showing data that is a comparative blinded grader review data that will evaluate our phase 2 data that has been presented previously versus data that has been published in JAMA Dermatology that details the results of oral minoxidil 5 milligram immediate release and topical minoxidil 5%. And in essence, what we did in this study is that we identified 6 alopecia experts and we blinded them to treatment, right? So we didn't say, is it the extended release tablet? Is it the topical minoxidil? Is it the oral minoxidil 5 milligram immediate release? And then we blinded to baseline images as we showed them before and after images, meaning that you see the before and after and you're not told which one is before. And the reason that we do that is that if I don't tell you which image is before and which image is after, and you can reliably determine the before image, then that means there's a visible difference between photos. We then had these individuals grade on a 7-point scale, an investigator global assessment, those images from much worsened to much improved. And in essence, what we saw in this study is that in terms of baseline identification, meaning the percentage of subjects with visibly noticeable change, there was a statistically significant difference between the percentage of subjects taking VDPHL01 who had a statistically significant change and those taking oral minoxidil immediate release 5 milligram or topical minoxidil 5%. Similarly, when we look at the magnitude of that change, so how much hair growth an individual had, we saw nearly 2 times higher amount of hair growth on the investigator global assessment that was also statistically significant in this study. There are 3 things that really stood out. One is the speed of onset. The second is the consistency of onset. And the third is the intensity of onset. From a speed of onset perspective, in this study, we compared patients in our trial who received VDPHL01 for 2 months versus patients who had taken oral minoxidil 5 milligram immediate release or topical minoxidil 5% for 6 months. So it was 3 times faster. From a consistency perspective, we saw that there was a statistically significant difference in the percentage of patients where the experts could identify the baseline, meaning more patients had visibly noticeable change. And then from an intensity perspective, right, the amount of hair growth, when we look at that investigator global assessment, we saw, essentially 2 times greater response for VDPHL01 than with oral minoxidil 5 milligram and topical minoxidil 5%, even though the VDPHL01 was only taken for 2 months and those agents were taken for 6 months.